The human heart beats about 100,000 times a day. To maintain that relentless pace, this powerful muscle acts as its own engine. And like any engine, it needs a continuous, uninterrupted supply of oxygen and nutrients to function. That fuel is delivered by the coronary arteries. Inside a healthy artery, oxygen-rich blood flows rapidly, rushing straight to the heart muscle without resistance. But over decades, cholesterol and other cellular waste can slowly accumulate within the walls of these arteries. These fatty deposits are known as plaque. This gradual narrowing creates a bottleneck, yet blood usually continues to squeeze through the remaining opening. This slow buildup sets the trap, but it isn't the heart attack itself. The actual crisis is sudden. A vulnerable cholesterol plaque becomes unstable and forcefully ruptures under the pressure of the blood flow, ripping open to The body instantly recognizes this rupture as an injury. Microscopic blood cells called platelets swarm the site, attempting to heal the wound by forming a clot. Inside an already narrowed artery, this defense mechanism backfires. The clot rapidly expands, severely restricting the remaining space, and often sealing off the artery completely. That physical dam creates a complete mechanical failure. It stops red blood cells in their tracks, entirely cutting off the fuel supply to the heart tissue downstream. With the supply line severed, the specific region of the heart muscle relying on that artery is immediately plunged into crisis. In this animated cross-section, notice the rapid drop in oxygen saturation, shifting healthy tissue into severe stress. The entire heart doesn't instantly stop beating. Instead, one specific section actively starves, while the rest struggles to keep pumping. If the blockage isn't cleared and blood flow restored, this localized deprivation inevitably leads to permanent, irreversible tissue death. While this biological crisis unfolds on a microscopic level, the physical manifestation is felt intensely on the outside. This anatomical map highlights the pathways where internal damage registers as physical pain. Patients often report severe chest pressure, along with pain extending to the left arm, neck, and jaw, accompanied by shortness of breath and cold sweats. However, the warning signs vary significantly. Some individuals, particularly women, older adults, and people with diabetes, may experience unusual tiredness, nausea, or lightheadedness, entirely lacking severe chest pain. Recognizing these varied signs is vital. Regardless of how typical or atypical the external symptoms feel, the internal mechanical failure is progressing rapidly. In emergency medicine, there is a strict rule for heart attacks. Time is muscle. This timeline chart correlates minutes elapsed since the blockage with permanent heart muscle cell death. The sharply upward curve shows the exponential risk of irreversible damage. Every minute of delay eats into this shrinking window, dictating the patient's long-term survival. The moment a patient arrives at a modern emergency department, the medical team races to assess the situation. Doctors immediately use an electrocardiogram, or ECG, to measure the heart's electrical activity. This test detects the invisible electrical anomalies caused by the starving, stressed heart muscle. They also draw blood to test for cardiac troponin. This is a specific protein that leaks into the bloodstream only when heart muscle cells are damaged. By combining these external readings, physicians can accurately confirm the presence of the internal blockage in real time, clearing the way for a mechanical rescue. The immediate medical intervention often involves threading a sleek, flexible tube called a catheter through the patient's vascular system, routing it directly to the site of the coronary blockage. Once in position, a tiny balloon of the tip of the catheter is inflated. This forceful expansion physically crushes the offending plaque and blood clot against the artery walls, widening the narrow passage. To ensure the passage stays clear, a wire mesh tube called a stent is deployed. The stent expands and permanently locks the newly opened artery in place. A moment of relief. With the physical dam broken, a massive high-speed rush of red blood cells flows freely through the newly stented artery. Following that restored blood flow back down to the starving heart muscle, the sudden return of oxygen revitalizes the affected tissue and halts any further damage. Stepping back to look at the entire cardiovascular system, the human heart stabilizes, beating strongly once again after surviving the crisis. Preventing future blockages requires active, ongoing maintenance. Under medical guidance, this means managing individual risk factors, like blood pressure, cholesterol levels, diet, and smoking habits. Because a heart attack is always a race against time, recognizing the warning signs and acting immediately is critical. Do not wait to see if the symptoms worsen. If you suspect you or someone nearby is experiencing a heart attack, seek emergency medical help right away. Time saved is heart muscle saved.